Have you ever really stopped to think about how much your eyes are telling you beyond just, what you see? We tend to take our vision for granted, I think, but it's such an incredibly complex system, constantly processing the world and maybe surprisingly even giving us clues about our general health. So today we're doing a deep dive into the really fascinating world of eye health. We've looked at a whole range of insights covering conditions, exams, treatments, basically trying to give you a shortcut to being really well informed. We want to uncover some important nuggets of knowledge, from the common stuff like needing glasses to the maybe more surprising signs about your overall well-being. Okay, let's unpack this.
Yeah, what's truly fascinating, I find, is how deeply our eyes are integrated with our body's systems. They aren't just separate cameras. They're almost like a visible diagnostic dashboard, offering these crucial insights if you know what you're looking for.
Absolutely. And I guess for most people, thinking about eye health starts with the eye exam, right? That chart, the Snellen chart, we've all seen it. Letters getting smaller, it measures visual acuity, usually at what, 20 feet?
That's right, 20 feet is the standard. And 20/20 vision, that just means you see at 20 feet what someone with average vision sees at 20 feet. It's the baseline.
Hmm.
But it's interesting, some people, like elite athletes, might have 2015 or even 2010 vision. They see things sharper or further away.
Wow, so better than average.
Exactly. But the really key thing here isn't just hitting 20/20, it's noticing changes. If your vision suddenly drops or gets significantly worse, say 20/40 or poorer, well, that's a clear sign you need to get it checked out, and probably urgently.
Okay, that makes sense. Sudden changes are always a red flag. But the exam is more than just reading letters, isn't it?
Oh, absolutely. Way more. Think of it as a full health check for your eyes. You've got things like the Ishihara test, those plates with the colored dots. That checks for color blindness. Quick and easy. And then there's the red reflex test.
Ah, I've heard of that, especially for kids.
Yes, exactly. It's incredibly important, especially for babies and young children. Basically, the doctor shines a light, looking for a normal reddish reflection from the back of the eye. If it's blocked or looks white or different between the eyes, it can signal abnormalities, things like cataracts or even rarely a tumor.
Wow, so simple, but potentially finds serious issues.
Precisely, because if vision isn't clear early in life, the brain can actually start to ignore the signals from that eye. It
Right.
can essentially shut down its development,
Right.
which can lead to permanent vision loss. So it's a vital early warning system.
That's a really powerful point about early detection. So people might think the exam's just for glasses, but
Right. That's a common misconception. Oh, I just need my prescription updated. But it's so much more. We're assessing the optic nerve, looking at the retina, checking eye pressure, detecting subtle changes that might point to eye diseases like glaucoma or macular degeneration, or even, like we said, hints about broader health issues, maybe even before you notice any other symptoms.
Right.
That precision is key for proactive health.
okay, that really highlights the importance. Now let's talk about some of the really common vision problems people experience, like nearsightedness, myopia.
Yep, myopia. That's when you can see things clearly up close, but distant objects are blurry. And the opposite is hyperopia, or farsightedness. Distant vision might be fine, but close-up things are blurry or cause eye strain.
And luckily for both of those, corrective lenses, glasses, or contacts work really well for most people.
They do. They correct the refractive error, how the light focuses in your eye.
Mhm.
But beyond just focusing light, there's another important condition, especially in kids, called amblyopia.
That's the lazy eye.
That's the common term, yes. It happens when one eye doesn't develop proper vision during early childhood. The brain starts to favor the stronger eye. And treatment, often with glasses to correct any underlying refractive error, or sometimes patching the stronger eye. It's really crucial to do it early
Why is the timing so important there?
because there's a critical window for visual development. If you don't intervene early enough, the brain pathways for the weaker eye might never fully develop. It's essentially a race against time to encourage the brain to use both eyes properly and prevent potentially permanent vision impairment in that eye.
It's just amazing how much coordination is involved and how crucial timing can be. So we've talked about seeing clearly and correcting common issues, but what about the control system behind it all? The nerves. Here's where it gets really interesting, I think.
Definitely. It's an intricate network. Specifically, 4 of your 12 cranial nerves are directly involved with eye function. Nerves 2, 3, 4, and 6.
4. Okay, what do they all do?
Well, cranial nerve 2 is the optic nerve. That's the big one, transmitting all the visual information from your retina back to your brain.
Yeah.
It's all about visual acuity, what you actually see,
Got it. The information highway.
pretty much. Then you have nerves 3, 4, and 6. These guys are the movers. They control the muscles that move your eyeballs. Cranial nerve 3, the oculomotor nerve, is the powerhouse. It controls most of the eye movements up, down, inward, plus lifting the eyelid and controlling pupil size and focusing.
Okay, so nerve 3 does a lot. What about 4 and 6?
Nerve 4, the trochlear nerve, is a bit more specialized. It controls the superior oblique muscle, which mainly helps your eye move downward and inward. Think about looking down at your nose. And nerve 6, the abducens nerve, controls just one muscle, the lateral rectus, which moves the eye outward, away from the nose.
Wow, such specific jobs for each nerve.
Exactly. It's this incredibly precise coordination that allows your eyes to track objects smoothly, focus instantly, and work together. And if we connect this to the bigger picture, any problem with these nerves, maybe causing double vision or abnormal eye movements, could signal a neurological issue. It really highlights how interconnected everything is.
Fascinating. Okay, let's shift from the deep internal workings to maybe more surface level issues, things people might actually see or feel on their eye, like conjunctivitis, pink eye. That sounds straightforward, but you mentioned there's more to it.
Right. Pink eye isn't just one thing. There are three main types: bacterial, viral, and allergic. And telling them apart is key for treatment.
Okay, how do you differentiate?
Well, bacterial conjunctivitis often starts in one eye and can spread to the other. You typically get thicker, yellowish or greenish discharge, purulent drainage. That's when antibiotic eye drops are usually needed. Viral conjunctivitis, often associated with a cold, usually causes watery discharge and might affect both eyes. Antibiotics won't help here. It's more about supportive care, cool compresses, maybe artificial tears while your body fights the virus.
And allergic.
Allergic conjunctivitis usually affects both eyes simultaneously. It's itchy, often with stringy, whitish mucus,
Yeah.
and it's triggered by allergens, obviously. Antihistamine eye drops or oral medications are the way to go there.
Makes sense. Knowing the type gets you the right relief. What about other common, maybe annoying eyelid things, like styes?
Ah, yes, eyelid issues are very common. A hordeolum or stye is a painful red bump right at the base of an eyelash. It's an acute infection of a follicle.
Ow.
Warm compresses are the main treatment. Applied frequently, they help it drain. Sometimes a topical antibiotic ointment is used too. Then there's blepharitis. That's more of a chronic inflammation of the eyelid margins. Can cause redness, crusting, irritation.
Okay. How do you manage that?
Management is key. It often involves regular eyelid hygiene, gentle scrubbing with baby shampoo or special eyelid cleansers, warm compresses. Sometimes, if it's bad, antibiotic or steroid eye drops might be prescribed for flare-ups. And slightly different is a chalazion. This is also a lump on the eyelid, but it's usually further back from the edge, often painless and feels firmer. It's a blocked oil gland, not typically an active infection like a stye.
So it's the same treatment.
Similar start. Warm compresses and gentle massage are the first line to try and help it drain, but they can be stubborn. If they persist or get very large, sometimes an injection or minor surgical procedure is needed to remove them. But for many of these, simple at-home care like warm compresses really does help a lot.
Good to know. Okay, moving beyond those sort of common irritations, you mentioned the eye can be a window to our overall health. This is the part I find really amazing.
It really is. There's some less worrying things first, like a subconjunctival hemorrhage.
That sounds scary.
Looks traumatic. It's when a tiny blood vessel breaks on the white part of the eye, leaving this bright red patch. But it's usually completely harmless, like a bruise under the skin. It just resolves on its own over a week or two. No treatment needed.
Okay, good to know. Don't panic if you see that.
Exactly. Then there are things related to sun exposure, UV light, like pterygium and pinguecula.
Right, those growths you can sometimes see.
Yes, a pinguecula is a yellowish, slightly raised thickening on the white part, the conjunctiva. It doesn't grow onto the cornea, the clear front part. Usually harmless, maybe causes a bit of irritation. A pterygium does grow from the conjunctiva onto the cornea. It's more wedge-shaped. Because it grows onto the cornea, it can eventually start to affect vision or cause significant irritation.
And that might need surgery.
It might, yes, if it gets large enough or causes symptoms. Both are linked to UV exposure, so wearing sunglasses is really protective.
Good reminder. And dry eye. That seems incredibly common now.
Oh, extremely common. Keratoconjunctivitis sicca, the technical term. Your eyes just don't produce enough tears, or the tears evaporate too quickly. Symptoms are grittiness, burning, redness, sometimes even blurry vision. Management involves artificial tears, lubricating ointments, sometimes prescription drops to increase tear production, and lifestyle things like using humidifiers or taking breaks from screens.
Right. But now, the really systemic clues, you mentioned things on the eyelids or cornea.
Yes, this is where it gets really interesting for overall health monitoring.
Yeah.
Let's talk about xanthelasma.
Okay, what's that?
These are yellowish, slightly raised plaques that appear on the skin of the eyelids, often near the inner corner. They're actually collections of cholesterol lipids under the skin.
Wow. So seeing those means.
It strongly suggests you might have high cholesterol or other lipid abnormalities, dyslipidemia. It's a visible sign of lipid accumulation. And similarly, there's arcus senilis. This is a grayish or whitish ring or arc that forms around the edge of the cornea.
I think I've seen that sometimes in older people.
Exactly. It's very common in older adults, and after a certain age, it's usually not too concerning. It's also due to lipid deposits in the cornea. But if you see a distinct arcus senilis in someone younger, say under 40 or 50, that's a much stronger indicator of potential dyslipidemia. It's a significant sign in younger patients.
So both of those, the eyelid plaques and the corneal ring, especially if seen younger, are basically signals saying, check your cholesterol.
Absolutely. They're important external clues. Seeing either xanthelasma or premature arcus senilis definitely warrants a lipid panel blood test to check for high cholesterol or triglycerides. It's a really powerful example of how just looking closely at the eyes can provide a heads up about potential cardiovascular risk factors that someone might not be aware of otherwise. It really raises that important question about integrated health, doesn't it?
It absolutely does. What an incredible journey we've just taken through eye health. We've covered the basics of vision tests, common issues like nearsightedness and pink eye, the amazing nerve network controlling it all, and then these really quite startling connections between what we see on our eyes and what might be happening deeper inside our bodies, like with cholesterol. Understanding all this, I think, really does empower you, the listener. It helps you know what questions to ask, what signs maybe not to ignore, and just be more informed when you talk to your doctor. It's definitely not just about seeing 20/20, is it? It's about understanding the whole picture.
Exactly. The eyes offer so many subtle, and sometimes not so subtle, clues about our general well-being. So it leaves you with a thought, doesn't it? If our eyes can reveal so much about cardiovascular health or neurological function, what other parts of our bodies might be sending signals we haven't learned to read yet? Just think about the potential diagnostic power of careful observation, maybe even beyond the standard checklists. What else might our bodies be telling us?